This is the thyroid hormone pathologies video. Let's first take a look at hyperthyroidism. A common cause of hyperthyroidism is Graves' disease, and this is when we have thyroid stimulating immune proteins bind to thyroid gland TSH receptors and trigger thyroid hormone secretion. If we have a look at this part of the slide, we see thyroid stimulating immunoglobulins targeting the thyroid gland. These immunoglobulins have a very similar structure to thyroid stimulating hormone, and they have the ability to activate the TSH receptors. And remember that the function of TSH is to target the thyroid gland to produce thyroid hormone, both T3 and T4. In this case, the immunoglobulins acting like TSH trigger the thyroid gland to secrete thyroid hormone. So we have uncontrolled production of T3 and T4, which results in very high levels of circulating T3 and T4. This results in strong negative feedback, both to the anterior pituitary and the hypothalamus. So as a result, we have low levels of TRH secreted and low levels of TSH secreted. Let's take a look at the symptoms of hyperthyroidism. These are shown in the green, and also the physiological mechanisms shown in the grey. With hyperthyroidism, or in other words, too much thyroid hormone, we see a rapid heartbeat and increased force of contraction in the heart. This is due to upregulation of beta adrenergic receptors in the heart. We also see warm, sweaty skin and heat intolerance. And this is due to increased oxygen consumption and metabolic heat production as a result of the high levels of thyroid hormone. We also see muscle weakness, and this is due to increased protein catabolism caused by high levels of thyroid hormone. There's also hyperexcitable reflexes and psychological disturbances, and at present the mechanism for this is unclear. Let's take a look now at hypothyroidism due to low iodine. Remember that iodine is a raw material for the production of thyroid hormones. What we can see with hypothyroidism is goiter, and that's shown in this photograph here. This swollen region of the neck here is called a goiter, and it's actually due to an enlarged thyroid gland. It's due to high levels of thyroid stimulating hormone. Remember that thyroid stimulating hormone, in addition to targeting the thyroid gland to secrete thyroid hormone, also promotes growth of the follicles within the thyroid gland. So what you're seeing here as a goiter is an enlarged thyroid gland. So let's take a look at the flow chart here. We see low iodine in the diet. And remember, iodine is a raw material for the production of T3 and T4, so as a result we have low levels of T3 and T4. This results in no negative feedback to the anterior pituitary and the hypothalamus. So as a result we have increased secretion of TRH and increased secretion of TSH. So these factors here are tied to the lack of negative feedback because of the low thyroid hormone circulating due to low iodine in the diet. Remember that a function of TSH is to stimulate growth of the thyroid gland. So as a result, the thyroid gland enlarges as seen in this photograph. Let's take a look at the symptoms and physiological mechanisms of hypothyroidism. So in other words, not enough thyroid hormone. Again, we have the symptoms in green and the physiological mechanisms shown in grey. In children, we see cretinism, and this is marked by decreased mental capacity. And this is due to a poorly developed nervous system because thyroid hormone is very important for the normal development of the nervous system. We see slowed reflexes, slow speech and thought processes, and also fatigue. And this is due to nervous system changes that occur in adults. There's an intolerance to the cold, and this is due to decreased oxygen consumption and metabolic heat production. Remember that an important effect of thyroid hormone is to set the basal metabolic rate. So with low levels of thyroid hormone, we have a low metabolism and therefore a low heat production. We can see brittle nails, thinning hair, and dry, thin skin. And this is due to decreased protein synthesis. The primary cardiovascular change in hypothyroidism is bradycardia, or in other words, a slow heart rate.